favorite twin OBGYNs from right here in Chicago. So please welcome back Dr. J and Dr. I. We're playing a little fact or fiction.
That's right. We're going to play. You guys ready for this?
I'm ready.
Are you ready, audience? Okay. We're going to play fact or fiction, and we're basically asking, are the statements on women's health true or false? In the audience, you all get to weigh in. You all have your cards. So let's get started. I'll get started with the very first one. Here we go. Fact or fiction? Women hit their sexual peak when they're 28, men when they're 18. Is that a fact or is that fiction?
I'm going fact on this.
I'm going fiction. I feel like the woman part is wrong. I feel like the man is right.
I don't know. I'm kind of
Thank you. The one guy there put fiction. He put fact at first. I was going to say, come on. Fiction.
Oh, it's fiction?
It's fiction.
No. Yeah, it is fiction. This is the smart side of the room. It is fiction.
It's fiction.
This is the smart side. Yeah. If you look at it hormonally, women do peak in their late 20s, early 30s, and men do peak around 18. But it takes a lot more than just the hormones to kind of make you reach your sexual peak. So for women, it's all in the head, you know? Okay. So if you're not in a good relationship, you're not going to be sexual no matter what. Guys, I think we're ready to go from 18 to 80, so it really doesn't matter.
There you go. All right, so here, let's go to the next one. Too much exercise is bad for conceiving. Too much exercise bad for conceiving? I'm going to say...
They're all saying fiction. Pretty much everybody's saying fiction.
I'm going to go fact.
Oh, that guy. He said fact. He needs to be up there. It sort of is fact, actually. Too much exercise. Yeah. Too much exercise, if it's too much, can be a stress on the body.
Like, what is too much?
Well, it's different for different people.
Okay.
But if you're in a stress state, your body makes cortisol, which is this hormone that pretty much can shut the ovaries down. So you're not ovulate. Exactly. You don't ovulate. You're not releasing eggs. It can affect your hormones.
Oh, okay. All right, here's the next one.
Okay.
Sexually transmitted infections and accidental pregnancies are concerns for younger and older women.
All right.
Oh, I think we're unanimous with this.
Oh, no, he said fiction up there. He said fiction.
There's a couple fictions.
There's a couple fictions.
He just wants to be on TV.
What is everybody else doing, right? No, that is absolutely a fact. Regardless of what age you are, you can, contract an STD, and until you're menopausal, you can get pregnant. So you still got to take precautions. We're actually seeing more STDs in postmenopausal women now than we are in premenopausal women because they figure I can't get pregnant, which they can't, but you can pregnancy is not the worst thing that can happen to you.
Exactly.
Right. It's a lot of Stellas getting their groove back. Yeah, in the 60s, huh?
Hey, it's good. Hey, you know what? It's good for business, though. So
all right, breastfeeding is a great natural way to not get pregnant. Oh, I know this one.
Is this true? I don't know this one.
I mean, yeah, I'm sorry. I had a brain fart.
Yeah. Well, you know what? Breastfeeding can be a great form of birth control, but not for everybody.
Oh, no.
Yeah. You say, oh, no. We have a lot of patients who can attest to that, too. But basically, you have to meet 3 criteria. You have to have had your baby within 6 months. So if it's been longer than 6 months, you start ovulating again. You have to be strictly breastfeeding. So not just, breastfeeding sometimes and bottle sometimes. And you have to breastfeed frequently. So they say like every 4 hours during the day, every 6 hours at night.
Right.
So
my third child is a breastfeeding baby.
Exactly.
Oh, really?
Yeah.
You're a doctor.
I know. You should know better, right?
To this day, my wife is still like,
All right.
Are you fooled because when you breastfeed, you don't have a period,
exactly.
right?
You don't have a period. And then when you do ovulate for the first time, your period would come a few weeks after that. But if you get pregnant, it doesn't come. It doesn't come.
Oh, I never knew that.
Oh, you didn't know that? Yet another reason to have a baby.
All right, here we go. We have a viewer question. It says, with the Rio Olympics coming, there's a lot of talk about Zika in the news. Is Zika something that pregnant women in this area should be really concerned about? And what can pregnant women do to avoid Zika?
Absolutely. Zika is not only coming, it's actually here. I diagnosed my first pregnant patient with Zika about 4 weeks ago. Yeah. And Zika is really nasty in pregnancy because the virus is so small, it can cross the placenta, get into the baby's bloodstream. Yeah, and it infects the brain, And so it's here, and so we're telling patients basically prevent exposure. So that basically means 2 things. It can be either sexually transmitted, so if you're with somebody who has Zika or who has traveled to a Zika endemic area, use condoms. But the problem with that is Zika doesn't always say, like, Zika, I'm here. Sometimes the symptoms are so generic. No, truly. You can just have like cold symptoms, like a runny nose, rash, so you don't always know. So anybody who has Zika or could have Zika,
or travel to the area where Zika is, don't have sex. Just don't have sex.
Or use a condom.
That's the moral of the story. Doctors, thank you so much. No.
Dr. J, Dr. I.
Head to WindyCityLive.
That was fiction. That was fiction.
Head to WindyCityLive.com. trust me, don't do it. For more on Dr. J and Dr. I and their medical blog, Twin Doctors TV. Oh, that was funny. Up next, my son Max and Ryan had way too much fun at Six Flags Great. You hit my son doing this stuff?
He's a trained professional now. We'll be right back.